So what do they look like? What do families report to you and me or to our nurses? Well, obviously, there's some type of abnormal behavior that's typically witnessed in or around the litter box. Maybe the urine is even grossly discolored. So we have stranguria, polacuria, dysuria, or painful urination, periuria in inappropriate places. They cry. We all know, have heard, or had parents tell us how horrible it sounds, sometimes like the death howl. They don't feel well, they're not eating well or at all. Sometimes they strain so much or they've developed their AKI to an extent that we have uremia and they have vomition because of those reasons. And it hurts. So one of their natural responses is going to be to try and resolve the obstruction themselves by licking at their perineal area or directly traumatizing the penis itself. And so when we examine these patients, obviously we're going to feel usually a firm, turgid, very large, painful urinary bladder. They'll cry. They may be moribund on the table until you actually palpate that bladder, and then all of a sudden you get a very severe reaction. If they're presented in shock, as many of them are, they'll be hypothermic. They certainly are often dehydrated. Examine the penis area, examine the perineum. You're often going to see at least erythema, if not actual trauma. And as we all know, typically from either shock and or hyperkalemia, these patients are often presented with meaningful bradycardia as well. In terms of diagnostic testing, I like to think in emergency scenarios in terms of a minimum database. What do I feel I really need to know So I want to know a PCV total solids because a lot of these patients are anemic at presentation. Obviously, we need to know renal values. If I had to choose one, I'd want to know creatinine, but if you can get creatinine, BUN, phosphorus, that's ideal. Electrolytes, for sure, you need to know potassium, and I'm even going to put a plug in for calcium because hypocalcemia is relatively common in these patients. Urinalysis for obvious reason, and ideally a urine culture because the vast majority of these kiddos do not have active urinary tract infections. And in the interest of not promoting antimicrobial resistance, for having good stewardship for antimicrobial use, submitting a culture is appropriate to make sure that we don't need a antibiotic. Diagnostic imaging, at least looking for radio opaque uroliths if you don't have ultrasonography. I like to do a combination of radiography and sonography because sonography is also obviously great to look within the urinary bladder, maybe even over the pelvic brim, but obviously then the pelvic brim gets in the way and you don't really know what's going on in the penis with ultrasound. So combination of both of those diagnostic imaging modalities is great. Why do I want a venous blood gas? I want a venous blood gas because the vast majority of these kiddos are going to come in with some degree of metabolic acidosis, and having as much data as possible is great. And electrocardiography, especially if you detect bradycardia on your physical exam, and or if you document hyperkalemia and we need to intervene with some of the medicines that we'll talk about in a few slides.